Hello, everyone, and welcome to the Babies in Common Show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. As a reminder, any information shared during this show is not to be taken as medical advice. Please consult your own healthcare providers for questions about you or your baby's health, and visit babiesincommon.com/disclaimer for more information.
So today's Wednesday, September 30th, 2020. It is fall, and I'm excited because here in Massachusetts, leaves actually fell down onto the ground.
I know the
There was
foliage
fresh
is
fall air.
beautiful.
I know. I feel like that, just saying that reminded me of that Saturday Night Live skit where they're doing the podcast, like the radio show.
Oh, yes.
It was beautiful. So beautiful. Lovely. Oh, yeah. All right, so today we're going to be discussing infant massage with a focus on how it can help with feeding and digestion in babies. And we have our guest today is Sejal. So thank you for coming. Welcome.
Thank you for having me.
Awesome. So let's start with some background info. So Sejal Fichadia is an international board certified lactation consultant who's also an experienced postpartum doula, certified infant massage instructor, and certified tummy time method instructor. And she's originally from India, and she now lives in Oregon with her husband and her 2 kids, and she's currently offering online infant massage and tummy time method classes. So check out her website at kindredmothercare.com.
Awesome. I loved doing infant massage with all my babies. I mean, who doesn't love a massage? In fact, we used to call it sweet potato time because the doctor at the hospital that I gave birth to my first at, she said, you don't have to buy any fancy creams, just like some organic extra virgin olive oil or organic extra virgin coconut oil, so I would use olive oil, and it always reminded me of my mother-in-law's sweet potatoes, the when they cook, because she used tons of olive oil.
Oh, wow.
So we'd say, sweet potato time, and the baby would we would just get so excited. So I think that my baby smelled scrumptious after sweet potato
Well,
time
they smell
and baby
scrumptious
massage.
anyway.
Yeah, they do, right? So
Yeah.
I love doing infant massage. I'm excited for today's show.
Yeah, that's funny. You could have mixed a little basil in there, and then it would have been a whole other different thing. You would have been like,
that I actually might have consumed him, let's be honest.
I know. I did a little bit of massage with my kids, and I wish I'd known more about it. I think I learned more about infant sign language at the time, less about massage. And although my son's a really good massage therapist, he's almost 7. I shouldn't say massage therapist. He's got no training. But he does massage, but he doesn't like to, and he's so good at it. And I was just like, is there a study out there, Sejal, do you know, like that kids who receive massage as babies are more likely to enjoy giving their parents massage later? Because that would be a really good motivator.
Well, not really, but I hope there was a study for sure. But
I can use my own kids as an example. My boys always love to give me a massage. So it's not the worst back rub I've ever
my kids when they were little. We'll just see how yours are when they're bigger.
True.
Yeah.
Maybe that'll be your PhD project.
Yes. Yeah. So were you doing massage with your babies? Did you know about it back then, Sejal?
Yes, I grew up with massage.
Oh, I've heard about that.
In
That's right.
India, it's a very common traditional practice to have massages for the first 45 days or so for both the mother and the baby.
For the mother too.
Yes, both of them get it. And it's part of, postpartum care that we get as moms in India. And I saw my siblings being massaged by first my grandparents and then my mom, and I learned from them, and then I massaged my cousins, and that's how I learned about infant massage. And when I came to the United States, had my own babies, I did massage for both of my kids, and they still come here and there when they are stressed out or tired, or they'll be like, oh, can you just do my feet massage, or can you just pull on my toes for a little bit, or especially teenagers, they're always busy doing something and they don't want to talk to you much. So one way to get them to talk is to give them a little shoulder massage or a foot rub, and they'll be like, oh, I'll talk to you about my day. So
Oh, that's so sweet.
that's how I kind of do it. But growing up with massage has helped me tremendously in feeling confident about being an educator. And I massage my niece, my brother's daughter, she's 2, and she loves massages. So I give her a massage when I go see her in Washington. So that's like the beginning of infant massage. Then when I came here, I noticed that that's not very common practice other than the Indian households here. So I felt like there was a need for me to get certified when I became a postpartum doula, to make sure that I'm teaching according to, the a- association that certifies me. And there is no standard certification per se. There are various privately owned organizations that are, teaching infant massage to people to become educators. um, but what I think is that if you as a parent want to start massaging your babies today, go for it. There is no wrong way to do it, as long as you are able to, tune into your baby's radio station.
Oh, I
You're
like
good.
that. Either
Yeah.
there's so many things I feel like American culture could learn from the way many Indian families take care of new
Yeah.
parents in their. As a labor and delivery nurse, some of the most my most favorite patients were my Indian patients because their mother or mother-in-law would come from India
Mm-hmm.
and care for them and the baby so much.
Hmm.
And so it's wonderful that you're taking not only your family and cultural traditions, but also newer methods and ways to kind of incorporate it into an American culture. I think that's wonderful.
Hmm. And I think that you, the thing is that you begin at the beginning. Just if you don't begin, and if you're going to be worried about routines or how it should or should not look, it's going to be harder to begin. So
True.
start with just one leg at a time, or one foot at a time.
Again, so before we started recording, there was
Yeah.
something that Sejal said, and I said you need to make a meme out of it. And so, okay, yet another one. Okay, start with
Yes.
one leg. I love
I
it.
don't know if
You-
that could be a meme.
It's an educational graphical post, like have a little, like have a picture of a baby with just, you can see the hip and the leg and be like, infant massage,
Yeah.
just start with one leg.
Yes, yes. And
That's
really,
great.
literally, it
Yeah,
is that, right? Because
sure.
when we see a baby, even as lactation consultants, when we are examining babies, they are on their backs. And what is the first part of body that moves? It's their leg.
Hmm.
Right.
They say hello to
Kick,
the
kick,
world
kick,
with their
kick, kick.
legs. Yeah.
Mm-hmm.
Mm-hmm.
And then their arms start going, and then their vocalize things, right? When they're hungry, you will see that they try to, kind of break out of their swaddle with their legs first.
Mm-hmm.
Mm-hmm.
So that is the safest place to start. If I have to give one tip, that would be it. That
Well,
start
we're
with one
hoping for
leg.
a lot more tips than one.
So let's start with the basics, Sejal. People might be thinking a massage, is a deep tissue fascia,
Yeah,
Swedish massage hut
yeah,
stones, right? What adults get. But that's
right.
not what you're talking about when you're talking about infant massage. So what exactly is, if you can give us the elevator talk for infant massage?
Yeah. So to me, infant massage is something that is a mutually beneficial give and take of love and connection between parents and their babies. It's just, the back and forth. And we are doing it through touch. And eventually we incorporate our voice of the parent, right? And the baby will respond back, whether it's by looking into our eyes for a few seconds as a newborn, or whether it's cooing back at us as an older baby. So that is where it begins. In fact, in India, infant massage is so commonplace that in some parts of India, like Mithila, which is in East India, parents are taught that if you don't massage your babies, they won't be brave.
Wow.
Oh,
Massage is connected to bravery. And I don't think
Interesting.
it's necessarily like bravery with a sword pulled out of your side. It's more about, instilling confidence through touch, right? And making the parents kind of be the therapy or
Mm.
be the intervention. And that's what it's about. When I was growing up, infant massage I saw done was done by a special woman who would come and give the massage to the mother and the baby. And she may not have been a family member, but she would be someone who was doing this for generations. She
Wow.
did it, her mom did it, and she would come for the first few weeks. And then eventually, the mom and the grandmother or whoever was taking care of the baby would learn from her.
Wow.
And then
So you
that
have
would
traditional
continue.
birth attendants historically, and in India there are traditional massage attendants.
Yeah, I won't call them therapists because they are
Right.
actually not even, they don't go to a specific school, but it's the wisdom in their hands
Mm-hmm.
of,
Right.
years of
Yeah.
knowing it from her mother probably. So that's where it started for me, that, you really don't need a massage degree. And we are technically not even therapizing anything or
Mm.
anybody. It's about
Mm.
continuing to make that connection with the parent and the baby together. It's,
It's a therapeutic touch, right?
right,
It's
Yeah.
not like you're trying
right.
to do chiropractic care on the baby,
No,
but
there
it's
is no
just a
manipulation.
therapeutic touch.
Yep.
It's
Yep.
wonderful.
So
Aw.
increasing the sense of security in the baby and increasing confidence in the parent, right? And if you do a certain thing multiple times, that is how you build confidence for any skill.
True. Right. And then what about the other benefits? I know I've seen lists of infant massage is good for this and it's good for this. So can you share what
Right.
other benefits? I think there's even studies that have shown this, these
Yes.
benefits.
So for babies that were born preterm, there are a lot of studies done that were, some of them were done at the Touch Institute in Miami by Dr. Tiffany Field. And although massage has been documented for infants since 2760 BC in
Ah,
China.
Oh,
Yeah,
wow.
wow.
so we
Okay.
have documentation on it. It's just not the randomized controlled trials that
Mm-hmm.
we are used to in this day and age, but it has been
Sure.
Although
around
you
for
can't do a
ages and
randomized
globally.
control, you
Yeah.
can't really do a control study on massage because you either
Yeah.
you know whether you're getting massaged or not.
Right.
But they kind of did
Although with
one in
babies, maybe you could.
2017. They
Oh,
Okay.
did one. Yeah. So they did one in 2017 where they um, kind of wanted to see the effect of when a baby gets venipuncture or when a baby gets poked,
Okay.
whether massage is helping them handle the pain. And they scored the babies with the neonatal pain score. And they found out that babies that were, they had the control group, then they had the babies that have had been breastfeeding, and then there were babies who were massaged. And, as much as I love breastfeeding, they found that massage helped them manage the pain better than breastfeeding, and the control group were not able to manage the pain at the same level.
Hmm.
So
wow.
there are studies, and we are getting to that place. But I think, like Jeanette said, that it's harder to do randomized controlled trials on infants. First of all, it is harder to get it approved.
Hmm.
But there are some studies here and there that will pop up. The other thing is weight gain. For preterm babies, weight gain is a huge issue. And what has been the most consistent outcome across all research is that preterm babies that get the massage, infant massage, had a better weight gain than those that did not.
Wow.
So that I mean, to me, as a lactation consultant, as a mother, that's what I would want for my baby, right? And it is also about, you know, a continuum of skin to skin contact for me.
Hmm.
So
Right.
you do
Right.
skin to skin contact for the first 6 weeks of life, and then it kind of goes away, or we kind of get busy with more parenting stuff. But what I find, that if you continue doing massage for your babies, that is a continuum of an extension of skin to skin. To me it
Right.
is.
Right. That makes
um, i-
sense.
because you are still doing using skin, which is the largest organ of your body. And
Hmm.
the benefits are not for just the baby, they are for the parent as well, right? We have enough studies that tell us that the maternal depressive symptoms are less when
Hmm.
the mother massages the baby. There is more bonding between the father and the baby. So it's not just only for mom, right? So we can support fathering through infant massage. There is also a lot of vocalization between the parent and the baby, right? So they are developing their cognitive skills, their vocal skills, their ability to sense, right? Because touch is our first sense that develops in the womb. And the sense that, what how much pressure do I like? Or how do I feel when I'm touched on the leg versus I'm touched on the arm, when I'm touched on the belly, right? And babies are very good at telling you what they like or don't like.
If you just
So
tap in and
if
pay
you
attention,
just,
yeah.
yes, if you just tune into the radio station, so if you just pay attention to what they're showing you on their face, the face is the sensory headquarter of our body. So it can tell us a lot of things because the eyes, ears, mouth, and nose, everything is on the face.
Hmm.
And your babies are going to tell you how they feel, how much pressure they like, how much pressure they would not like,
And by
right? So those
definition,
are
you're
the
tuning into your baby and what they like versus putting them
exactly
down and then nursing them and putting them down and putting them over your shoulder and then putting them
right.
down and then rocking them. And there's so much more face time involved
Yes, it is. It is. And there's
yeah,
also turn taking, right? So the turn
because
taking
the baby will
involves,
massage you back.
yeah, and also you have so many sensory receptors on your hands that you are gathering all the information you need from your hands. That when you massage a baby and they are feeling tense to you under your hand,
Mm-hmm.
no, okay, I need to work on this area. That will loosen up eventually. And you will feel when it loosens up. But if
Mm,
you don't do it consistently, you won't notice the difference.
right.
So, massage is not just some lovey dovey thing, it is actually a place where you do truly connect with your infants. Yeah.
So say more about that turn taking.
So the turn taking comes in where I am singing a song to my baby or talking to my baby when I massage, and the baby will try to mimic my mouth, the way I move my tongue. If I stick my tongue out at them, they will try to stick their tongue out at me. If I say ooh, they'll try to make that. Even if they don't make the sound, they'll do.
Yep, with their little lips. Yep.
And we all have seen it as lactation
Mm-hmm.
consultants, and I'm sure parents can also see it. And it is so much cost saving. So we are referring babies for any kind of body work, manual therapy, physical therapy. All of those therapies will stick better when you follow it up with massage. So there is also some homework that we can do, or we can teach parents to do, that will continue to benefit their baby and themselves, right? So that's where the turn taking comes in. And then the baby will decide that, oh, I'm not happy right now. So then the parent learns that, okay, this is a way that the baby is telling me I'm not happy, I need to pick them up,
Hmm.
right?
Mm-hmm.
So how do we read our babies?
Yeah.
So many things are swirling through my mind when you're talking. A few things as a labor and delivery nurse,
Yeah.
I'm thinking about attachment, right? And the release of oxytocin between mom and baby or dad and baby as you are doing the skin to skin touch with your hands,
Right.
and how amazing oxytocin is for bonding and also a calming effect, right? On you and the baby. So that's one thing that I'm thinking of. It's wonderful to have studies. And
Mhm.
I'm so glad that we do have studies that say that infant massage can affect some really important things, like how much weight gain your preterm
Mhm.
baby gains, right? But
Mhm.
also, I mean, just basically, I don't think anybody needs. Do you truly need a study that says touching your baby, looking at them in the face, and interacting with them is good? Because that sounds like in your heart that's good, right? Like interacting with your
Yes.
baby in your heart, you know that's good. So
Well, I
it's
think it is
wonderful.
once you start doing it or if somebody mentions it and then you try it. But I mean, we all have worked with first-time parents who, you know, maybe they don't like massage or they only get it from their massage therapist because their partner doesn't give her. Maybe, who knows what their history
Right.
is. And they've maybe never, sometimes, we work with people who've never held a baby before. Like they
Right. Or
literally
they
don't remember ever
didn't have
holding one.
touchy-feely parents. Like,
You
my
know?
parents gave
Yeah.
back rubs and, they
Yeah.
wasn't
And
specifically
so
infant
it's just
massage, but
the
Yeah.
experience can be so different. And so when someone says to you, well, look at your baby's face and stick your tongue out, they'll mimic you and they're like, oh, they will. And then you do it and they stick their tongue out and they're like, oh my gosh, and be like, ooh, and maybe they'll do that. They'll like curl, purse their lips and they're like, oh, they do. Or open your mouth wide. Even just latching, I'll say like, talk to your baby because the baby's fussing. And as soon as they hear their parent's voice, they're like, oh, okay, I'll latch on and be calm. And so there's so much of that little piece that some parents instinctively do it, and others are very, very quiet and stiff and they don't even know about that yet. And then you tell them, and they're like, oh my gosh, this is so cool. I can do this. So I think can become instinctive, but it's not always
no,
instinctive
no,
for
it's not
everybody.
always
Yeah.
instinctive. Absolutely.
Yeah.
No, I agree. And as far as, another thing you were talking about was kind of like the baby interacting with you made me think of how all babies have personalities. This baby might like this
Yes.
pressure, this baby might not like this pressure. Um, and so when we talk about like consent is a big topic, and I've heard when I've watched like infant massage videos or heard people talk, they
Yeah.
say, make sure you get the baby's consent first. So what does that mean when it's a baby, a pre-verbal baby, right? How can a parent figure out if a baby's ready and accepting of massage, if it's a good time to offer massage to the baby? Can you
Right.
speak to that a little bit?
Yes, yes. So consent is a big thing, and yes, we always want to be respectful of the baby, and what they want or don't want. But the thing is that if something is not offered, how would they say no?
Mm.
And if something is offered, maybe it was not the right time to offer it in that particular moment. So babies are very much about the present moment, and the present moment is always changing. So
True.
that is working. That is working to our advantage, right? So what we think is that in this present moment, I tried to massage my baby, and my baby kind of became fussier or cried or grimaced, whatever they may be doing. And we are kind of turned off by that. Yes, in the present moment, they didn't like it. Doesn't mean 10 minutes from now they won't,
Or
or
two.
10 hours from now they won't, or in the evening they won't. What they may not have liked in the evening, they may like in the morning. But unless we try it, you know, how would we know?
Do you guys
So
have cats? Melissa, you don't have a
I
I
cat,
have
do
a
right?
not have
dog.
cats, no.
You
I
have a
have a
dog.
dog.
I'm a cat person, so I know a lot more about cats. But like, we have two cats, and I've had cats before. And cats are very clear too. Like,
Oh,
I don't want
yeah.
you touching me now. And then they'll come up to you
Right.
later, and they're like, "Come on, massage me." And you're
Yeah.
like, "I
Right.
was totally ready to give you cuddles and rubs this morning," and you were like, "No, not at all." It's like only on their own time, you know.
Yep.
And they don't
Yeah.
talk either, like except for an occasional meow. But like, it's basically a baby because babies make a
Yeah.
meow sound too. So it's really interesting to think of it the way you put it, is it's so similar to a cat too. It's like you start to learn that back and forth from your own animals of what they
Right.
mean by the looks on their faces or the way they move their body or their voice. So
Correct.
yeah, absolutely, you could see that in a baby.
Yeah.
I'd say the
So,
same thing for like baby wearing too.
Mm.
I've had people say they have a fussy baby, and I say, "Why don't you
Mm-hmm.
try wearing the baby in the carrier?" And they're like, "I tried that once and they hated it."
Right,
Well, maybe
right.
in that moment, in that present moment, they didn't like it because it wasn't, but try again. It's not,
Mm-hmm.
So that's some good advice.
It's almost
yeah.
like it's almost like they're giving a ton of credence and credibility to that baby's way of communicating no, but they're making it a hard no. The one time
Right.
they said no, they'll never like baby wearing again. you know,
Right.
Yes.
Right.
Yeah.
if that was the case, very few people would eat vegetables.
Right.
That's
And
true.
I say that same thing as a lactation consultant when we are trying to help the parents with the latching or positioning. There are certain positions that we try and they may not work for every baby. And there are certain generic positions that we all have tried, right? But not
Mhm.
every single baby is going to be okay with that. And not every single parent will be okay with that. So we have to come up with creative ideas on how to make it work for the parent and the baby. Same thing goes for the parent. So this is where I say that the tuning in. So unless you turn that dial right or left, you won't know which is the right radio station for your baby, right? It's the same thing that if you want to be the external regulator for your baby and help them, understand what feels good and what doesn't feel good, you will have to try a plethora of different things, whether it's varying the time when you do it, whether it's wearing the pressure when you do it. And parents don't really want to ever hurt their baby. So you won't be using very high pressure strokes anyway for any infant massage. And if you do, your baby will let you know right away because they know how to say no by crying. That's their way of
Mhm.
communicating. And if they are happy, they will not cry. So that's
Mm-hmm.
an easy pre-verbal way to know. And you can also see some of the things that you will see on a baby is their breathing will change. Um, their nostrils will start flaring sometimes. They will have a little frown and they'll be
Mm-hmm.
like, I don't know
Like
about
that,
this.
the
And
eyebrows.
sometimes, yeah, and sometimes their frown will go away and sometimes it will stay. Then you know that, okay, I need to either back off or increase. And most parents that I have met, even when I have not taught them the class, they do less pressure always because they are afraid
Mm-hmm.
that I am going to accidentally do something that I'm not supposed to do, right?
Mm-hmm.
But contrary to popular belief, babies like the deep pressure touch.
Mm-hmm.
So,
Yeah, if you think
um,
about where they were for 9 months, they were
Mm-hmm.
tightly
correct.
hugged with your muscle
Mm-hmm.
of, your
Right.
uterus muscle. So,
Yes. Yes.
Mm-hmm. But
Yeah.
there are a lot of parents who are very nervous to even
Hmm.
hold their baby firmly,
Yeah.
you
Yeah.
know? And I mean, we all have worked with families where like it's almost like they're like, "Oh, but I oh,
Yeah.
you know, and you could just like imagine if you're a baby." And so I try to explain this like it's okay, you're not hurting them, you're just helping support them. And I
Hmm.
sort of model it on their bodies too. Like, you know, how does this feel if I like barely hold on to you versus this? You know, it depends on where I'm getting permission to touch them, of course, you
Yeah.
know, and they're like, oh, yeah, that makes sense, you know, and I'm like, just lift them, make them feel comfortable that you're confidently holding them. They're not going to fall anywhere.
Hmm.
But yeah, more pressure definitely tends
Yes.
to feel better.
Yes. And it's like, you are holding your baby for breastfeeding, you're holding your baby for burping, you're holding your baby for so many different things that you're doing with your baby, right? All those forms are passive way of touching the baby. Massage is an active way of
Mm,
touching the baby. So
sure.
there's the difference. So yes, I am with my baby all the time, 24/7 as a parent. So is that not enough touch? It's not about the amount, it's the quality of touch.
mm,
Yeah.
right. Is there a better time for most babies, or is it really about watching your own child's rhythm?
So I find that offering it to them at various times of the day helps you figure out what time of the day your baby prefers. Preferably as they are, kind of in that quiet, alert state as a newborn. And we have a very short window of that. I totally understand that. And that's why I say start with one leg, because even if you do one leg and not do the other, that's okay. Do the other one next time. Because babies have these sleep wake cycles every 2 to 3 hours. So there's your window. There's your window. Every 2 to 3 hours, you can offer it to them. And then eventually, once they get used to this kind of touch from you every day, multiple times a day, you will figure out in your own time that, oh, this time when I did the massage, my baby was calm throughout the time,
Mm-hmm.
right? And you may have a poopy diaper. I frequently have babies that have poopy diapers when parents start massaging them regularly because it stimulates the digestive system, it increases circulation in the body, just like for us when we get a massage.
Yeah, that's true. Now, I'm actually trying to imagine, is there a way you can describe? I know this is a tall order, but briefly describe, like, what an infant massage would look like if a parent was doing it. Like, about how long would it take,
Yeah,
and like what areas of the body are they touching and how?
right. So I say that begin with the legs just because it is the safest place to begin. The reason being that babies like to have their hands in midline, and that is what makes them feel safe because all of your vital organs, which are in your torso, right, from here on to here on, you have
Mm-hmm.
your heart, lungs, kidney, your gut, everything. So when you just start massaging their chest all of a sudden, when you have never massaged them, that is a threatening message. They will be like, wait, what's this? Right? So we want to
Right.
make sure that we start with the legs because the legs, and I'm going to show you with my baby doll if that's okay.
Mm-hmm.
So
Yes.
legs, you can just start with the toes. You can just do some deep compression on the feet around the ankles and start, right? And the baby can be in your lap, the baby can be on their back on the floor, um, or the baby can be in other another parent's lap and you can do the massage. So whatever, there is no rules as to where the baby can be when it comes to infant massage. People think that, oh, we'll have to have a setup where we have a corner where we massage the baby. Actually, not so much. I think that we should incorporate massage in the activities of daily routine for our babies. So if we are changing diapers on the diaper changing pad or on the floor, that's the perfect time to do it, right? And also making sure that the area where you are massaging your babies, eventually when you do a full body massage for your babies, you want to keep it nice and warm, because babies don't like being cold. Cold stresses them out, and then they freak out and cry. So
Right.
we want to make sure that it is like a spa setting. And it
Sure.
doesn't take a lot for a spa setting. You can just turn up a space heater in the area where you're massaging.
Mm-hmm.
Right. That's actually the way that I found it easiest for myself to massage
Right.
my daughter, Marceline. She was, and I don't know if I've talked about this on the podcast before, but my daughter got a very
Mm.
rare breast infection when she was a week old and had to
Hmm.
go to Boston Children's Hospital. And so that was like a traumatic event for everybody. She was in the hospital for 3 days on IV antibiotics. And so
After being
that
born
kind
at
of messed
home, by
up her
the way.
tummies after being born at home. Yeah, it wasn't like it
Mm-hmm.
was just this, it's just one of those rare random things that sometimes happens. It's called neonatal mastitis. But anyway,
Hmm.
side note, she was in the hospital and um so when she got home, I went on Facebook, my social media, and asked my trusted friends, like, is there anything, she just seems fussy and her belly seems, she's got diarrhea from the antibiotics. And, people recommended lots of different things. And some people recommended infant massage. So they gave me some resources that I used. And I was instantly overwhelmed at the thought of it
Hmm.
because I'm again imagining what you're saying, Sejal. Like I've got to have a special time of day and a special corner and special stuff. And
It's
I've got to
one
be
more
able to be
assignment to your day.
undistracted. Yeah, I was like,
So
one more
much to do
assignment. I already have
already.
2 kids. I'm recovering
Yeah.
from childbirth.
And you're
Like,
trying to do tummy
and
time
so,
and you're trying to breastfeed and
right. Yeah. And we were, oh gosh, it's just all. So, what I've just found, and what you're describing was during diaper changes, I would just do that. For those of you that are listening on the podcast and are not watching, Sajal was doing this like gentle but firm, kind of like wrapping her hand around the baby's, toe, starting at the toes, then the foot, then the ankle, then the thigh. And so, I would do that, because one of the things I had to do was air out her bum because she had this terrible diaper rash from the antibiotic diarrhea.
Hmm.
And
Hmm.
so, I'd change her diaper and then she'd be naked and I have to like let her air out. And so I would do this little bit of massage and it only took a couple of minutes and she loved it. And so
Hmm.
then once I got a little bit more confident, we incorporated the torso area and her hands and arms, and we would do that like after bath time. So
Hmm.
and that just seemed to work for her the best because it was kind of wind down time for the day. I could stick the kids
Hmm.
in front of the older kids in front of a show
Yep.
and I could just like cover her in olive oil or whatever and just and do that because my other boys loved it immediately, and it was just I'm a touchy feely person. I love to hug. So I would just massage them. It felt natural to me. But with my daughter, because she's in the hospital and she was fussy, I don't know, even as a third time mom, I kind of needed to build up my confidence. So that's I want to encourage people to not be overwhelmed by yet unquote another thing to do, right?
Hmm.
Because it can just be
Yeah.
Right.
little bits.
Yeah.
Exactly. And that's why I think for me teaching these classes um, is mainly not to just teach about the mechanics of the massage. That's not the goal. It's about supporting the parents in wherever they are in that journey, right? So whether they have a newborn, whether they have a older baby that's 5 months old, whether they have a 9 month old, that may look totally different for a 9 month old when you massage a 9 month old, right? I massage my
Sure.
babies up until they were 3 years old, and then they decided they want to run away every time we did the massage. And we were like, okay, well, if you decide to have it, that's up to you. I am
Squirrel,
not going to
squirrel.
push you. Yes, because they
You're
are
right.
so busy, right? At 3 years
Mm.
old, they are like,
Oh yeah.
they learn to say no and they want to do what they want to do. And, not a lot of structure in their day. They are just all over the place because they're figuring out the world. So,
Mm.
um, same thing goes for infants that, if you can make it and salt and pepper it throughout their whole day,
Mm.
that's how it is the easiest way to not make it a chore and make it something that you are both enjoying and not, it's not on your to-do list.
So, what would you say about
Definitely.
the parents who are either worried about doing infant massage
Mhm.
because their baby might spit up, because they have
Mhm.
a spit uppy baby, or they were told, which this is a whole other conversation we could do a whole show about, to keep the baby upright for 20 to 30 minutes after every feeding, which
Right.
is crazy, crazy. It's so hard to do.
Right,
Like, how about
right.
the person who told you to do that can come over to your house and do that? Because that's hours and hours of the day that you're holding your baby, which baby wearing could be helpful, but it's not working for everybody. But like when your baby spits up a lot, like what are you finding? Is it helpful to do that at a certain time frame after feeding? Is it helpful to prevent babies from spitting up perchance? Like what do you say?
So when I hear parents, and I get this question from parents all the time, as do you guys, I'm sure,
Hmm.
is that my baby spits up after every meal, and I don't know what is a good time to do the massage. And I tell them that, so whether you do the massage or not, is your baby spitting up?
Right.
If the answer is yes, then
Do it.
don't waste your 30 minutes just holding your baby. Do half and half. Wait for 15, and the last 15 do the massage. Um, some babies are happy spitters, like my second one. He spat up till he was 10 months old. No matter what I
Mm.
did, no matter, how paranoid I was about holding him upright, burping him, not burping him, doing gripe water, not doing gripe water, all kinds of things I tried, right, as a new mom. And this was 13 years ago. And I was not even a lactation consultant. So I was in that boat where my baby was spitting up, and I
Yeah.
thought he had reflux. And I went to the pediatrician. The
Mm.
pediatrician is like, "Nope, he's a happy spitter." And I was like,
Mm-hmm.
"No, he has reflux. You have to give him
Mm.
some medicine." She's like,
Mm.
"I'm not going to give your baby medicine because you
Well,
want
good for her.
Good for her. Yeah.
so so I was like, okay, fine. And I swear to you, it went away by 10 months. And he
Hmm.
was a chunker. He just had a loose sphincter that wasn't doing its job. And by 10 months, it matured and he was fine. Now, there are some babies who truly have reflux and who truly are uncomfortable on their backs. And that is why a mother's lap or a parent's lap is the best place for them, because when you crisscross your legs and have your baby in your lap, they are at an incline like this, right? And
Right.
that is keeping them semi reclined. And that is good enough for most babies, even for babies who have been told by their pediatricians that you need to keep them at a reclining,
But it also is
position.
giving the parents something to do, the more I think about it.
Right,
Because I
right.
think when you are finding that actually keeping your baby upright for 15 minutes or so actually is helpful to you or your baby,
Mhm.
then you're kind of like, oh, here I have to wait for a while,
Yeah,
and
what
of
are you going to
course you
do?
can watch TV and you can talk to your partner or whatever, but if you had something you could do in the same moments of like, oh, I can
Yes,
massage you by holding you on this incline,
right.
then after that's all over, you've done your massage, check,
Mhm.
and now the baby's sleepy and relaxed, and now everybody gets to go to bed.
Right. And it's
That
it's
would be
about,
nice.
making the best of whatever, is the situation for your particular household. And there is no rules that you have to massage in 15 minutes on the dot or 10
Right.
minutes. It can be after 10 minutes, it can be after 15 minutes. And like I said, you have to experiment. Without experimenting with the time and the baby's comfort level, we won't know what they truly
Mm.
are comfortable with.
Yep. Yeah.
What
That's so
about
true.
poop? This is another
Hmm.
very common question that parents have for their pediatricians. The baby's, not pooping enough. Maybe they seem uncomfortable. I have a lot of new parents say, "Oh, my baby's so
Mhm.
gassy. They're so grumpy because they're so gassy." And so, are there any special infant massage techniques that might be
Mhm.
able to help a baby who's that the parent believes is gassy or having trouble pooping?
Right. So, just like spit up, gas is a common finding in most babies. And most of the times it's a benign reason that the gassiness happens. And sometimes it's because of a shallow latch or air intake at the breast or bottle. And we can go into those reasons other time. But what I want parents to realize is that the process of eating, and then assimilating the food that they eat and eliminating the waste materials, including gas, is part of the learning curve for these babies, in growth and development.
Yeah, they've
Right,
never had to do that before. It's
Hmm.
right,
inside of you.
right. Correct. Somebody was doing it for them, or something was doing it for
Right.
them.
Right.
Yeah.
So obviously these experiences are teaching them about their own body and the sensations within their body. So, one of the things I find, when babies are gassy is, a lot of people recommend the bicycle legs. One thing I want to teach parents today is that when you do the bicycle legs, make sure that you do them slowly.
Right.
Because if you look at the baby here, right, and I'm doing my baby's bicycle legs, I want to go so slow that I'm actually able to bend the baby's leg and push it into their belly and then let it relax all the way. If you just do the bicycle like this, nothing is going to happen other than the leg moving. Now, what is relieving the gas is the front of the thigh pushing into the baby's belly. Does that
Right.
make sense? If you do it
Yes.
too fast, you are not letting that process even happen.
Well, also some parents
So go
are
slow.
thinking bicycling, so they're actually moving the knee away from the baby, like on the hip, and so there's
Right.
no
Yeah,
touching of the belly
yeah,
at all.
exactly.
And
So
so
you
yeah,
want
it's
to
very much
go
that.
slowly and one leg at a time. And babies do so much better when you go slower with them. Unfortunately, we live in a very fast-paced world,
Mm.
so that's harder, right?
Mhm.
And the pooping will happen once you start massaging them regularly. It regulates their gut. It
As long
regulates
as
their
they're eating
digestive
enough.
system
As long as they're
as
eating
long as
enough.
they are eating enough. Exactly.
Right.
So we
We have
have
to
to,
fix the feeding
there is
first.
always a caveat. Yes. As lactation consultants, we cannot, emphasize that enough, that we have to make sure that the baby is getting enough food for them to make some waste product, right?
Well, and just to touch on that too, like there's too many people out there in the world saying it's normal for a breastfed baby not to poop for several days, and
Yes,
that's
there
not
is.
true. That's not true. So,
Not true.
yeah.
And it is
There's a
uncomfortable.
difference
I mean,
between normal and common, right? Like it
Mhm.
might be
Mhm.
common, but
yeah,
that doesn't necessarily mean it's
Mhm.
normal.
Yeah.
right. And also, it's like, okay, if you didn't poop for 3 days as an adult, you would be pretty uncomfortable. And, you know, just because, again, babies can't verbalize this discomfort, they will either be grunting or fussy, and we really need to look at them, look at their feeding, look at how they're digesting their food, all of those things. And it's, somehow we have just made this general uh, recommendation that, oh, babies don't poop sometimes. And I'm like, okay, well, I'm not so sure about that.
Well, I'm always talking
So
about
infant
how,
massage can help with sorry, infant
yeah,
massage can help with getting the baby to help because you're talking about like stimulating the intestines, right?
Right.
Oh,
So
okay.
when you
yeah.
do, and there are plenty of videos on YouTube as well on infant massage, but when you do a clockwise massage on the baby's belly, and we are going to stay under the rib cage and above the hip,
Clockwise as
right?
you're
And
looking at
we're
your baby's
going,
belly.
yeah, clockwise as you're looking, facing the baby. So lower right corner of the baby's belly and a full circle,
And
right?
there's some people do the I love you
Yep. And you
motion.
can do all the I
Hmm.
love
Upside down L
you.
and an upside.
Yes. Yeah.
Right.
You can do those massages, but most people do it once and expect it to work
Right.
like that.
Right.
So when I am teaching these classes and teaching these massage strokes, and the ones that we talked about just now are in that handout that I give them, I always emphasize that please do this at least 2 to 3 times per session and
Hmm.
2 to 3 times per day
Per day.
and for 2 to 3 weeks.
Mm.
Right.
Again, it all boils down to consistency, 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 right? And it's not some magic button that we push and the baby poops. It is about giving consistent sensory input to the gut
Right.
externally.
Hmm.
Of course, feeding is the topmost thing, but if the bowels need help with movement because they are sluggish, then we can do that, but it has to be a consistent input to get good motor output, aka a poop.
Yes, yes. But also,
I wish there was a
part
poop
of
button on
that
babies.
part oh, it's like the easy button, but it's the poop button.
Yes,
Um,
right.
but part of like the normal movement of a human too could be having the baby laying on their belly, either on your lap or on a
Absolutely.
surface. And so that's going to put some pressure on their belly too. Or maybe it's your
Right.
hand on their belly as they're sitting and leaning over your belly, for
Yeah.
part of it,
So
like a
when
movement that you're
when
doing.
I am teaching back massage,
Mm-hmm.
I always tell parents that let's lay your babies on your lap on their belly
Mm-hmm.
so their head is kind of, they can see the floor,
Mm-hmm.
and their thigh, the parent's thigh, is firm enough to
Yep.
give enough compression to the belly.
Yep.
And what this kind of compression to the belly does is it activates the pressure receptors on the intestinal lining.
Mm-hmm. Do you find that parents seem shocked when you suggest holding their baby like that? Because I would
Actually,
imagine.
yes, they do.
Yes, right. That's what there's a whole lot of ways I've held a baby and people are like, "Oh, you can do that?"
Yeah.
And I'm like,
Yeah.
"Your baby looks very happy, don't they?"
Yeah. So as a postpartum doula, when I'm helping parents today, I was at a lactation visit this morning, and this baby needed naked weight we needed to do. So we were trying to take the onesie off, and the mom had to be with the toddler. So I was helping the mom with the baby. And when I took the onesie off, the mom was like, "Oh my gosh, how did I not know how to do this?" So all I did was the baby was on my lap and on the tummy, and I just removed the onesie from the back to the front, and the baby didn't cry. And she's like, "She screams for diaper changes and clothes changes, and she did not scream for you. How did I know? I not know. This is my second baby." And I was like, "I don't know. I just." It's something simple, right? But as parents, we are so preoccupied with so many different things for our infants and toddlers and older kiddos that it's hard to think that way. But whenever we are there as professionals, if we can give them a few tips to help them throughout their day, it doesn't hurt. So
Right.
same thing, like how many times do you actually, if your baby is a happy spitter like mine was, how many times do you have to change their onesies? So many times. That is your opportunity to get them on their bellies.
There you go. That's a great idea.
Like three,
Even
Yeah,
four
that's another
times at
thing.
least.
Even changing their diaper on their bellies
Yes.
is an
Yes.
idea. And
Yes,
it's
it
mind
is.
blowing, right? Because it's not done. Like, we don't think of it.
Yes.
Like, of course they're going to be on their back on the changing table or whatever pad I have. But switching it in our head, if you put them on their belly, yes, everything is backwards and upside down for you as the parent. But your baby may be totally happier in that position. And you just have to reorient your head of how you're doing things.
Right. Right.
It takes practice.
Yep.
I actually had a couple years ago, I mentioned this at my breastfeeding support group, and I said, okay, here's the challenge for the next 24 hours. I want you to all go home and try doing this belly diaper changing, and report back on our Facebook group. And it was very funny, the responses. People were like, "That was
Did
really
people
hard."
do it?
Yeah, they
yeah.
did. A lot of people did, and they were like, "That was really hard."
Well, it's funny.
Well,
My
it's
sister,
one day, so.
right. My sister has a daughter that's a month older than mine, my niece, and she was only turning her head to one side, and everything is fine now. It was a very mild issue, but so the pediatrician said, well, one thing that you can do is just keep flip flopping the way you change her diaper, meaning like instead of always putting her head on the left, if you're right-handed, do it on the put her head on the right, and so. It was really hard for her the first couple times she did it, but now she can change diapers ambidextrous. And I've been a labor and delivery nurse changing babies' diapers for 14 years, and it like blows my mind that she can change the baby's diaper right or left-handed. So it can be done. It can be done to change a baby right or left, or on your belly or on your back. I agree. It's about finding those little moments. People are like, tummy time. When do I fit in tummy time? It's like, well, right now we were just kind of all snuggling in your well, not me, but you guys were snuggling in your bedroom. I'm a postpartum visiting nurse, and you had the baby on the bed on their back, right? Well, what if you moved that comforter out of the way and put the baby, on their belly and did some tummy time there? You're right there, get down to the baby's eye level. And she was like, oh yeah, that's, a great idea. So
yeah,
we're going to have a whole episode coming up on Tummy Time with the actual founder of Tummy Time Method.
Ooh,
I love her.
Yep. She's in a couple weeks.
So speaking of sleep or beds, I was going to say, I've heard that baby massage can help with sleep too. And, that is another thing that parents are always asking about, poop and sleep.
Yes.
Can you tell us more about that?
Yes. So in terms of sleep, they have done quite a few studies. And while it has not been proven that it induces sleep, what has the research shown us is that when infants are given massages regularly, the quality of sleep is different, and the bedtime routine becomes easier for parents. So even though they don't necessarily sleep longer or faster, it is the amount of time that is spent winding down is decreased.
Mm.
Yeah. And the way it works, people believe or think, is that it regulates your autonomic nervous system,
Mm.
the sense,
Right.
the touch, right? Because the skin being the largest organ of our body, that is what is regulating the autonomic nervous system, because the skin is giving messages to the nervous system directly.
Right. And for babies who like bath time, that takes so
Right.
much time for parents. And
Right.
sometimes maybe a massage would do the same type of relaxation for the
Yeah.
babies who like them bath.
Right.
That could replace that because they're getting all that touch from the warm water. And
Right.
here's an opportunity where you don't have to go through the whole bath time and the drying and the wetness and the pool.
Yeah. Yeah.
Bath time can be, I think, more fun when the kids are older.
Yeah.
Yeah.
Yeah. I think
And
bath is
babies do not
overrated.
need a bath every
Yes,
night.
right. And
Yeah.
they don't need a bath every night for
Yeah.
sure, especially
Yeah,
in
yeah.
New England where we are. Well, probably Oregon either. Although I don't
No,
know.
it's
Yeah,
it's cold.
yeah, yeah,
Yeah.
yeah. Yeah. So, how about with feeding? Like, what would you say about babies who are struggling with feeding, incorporating massage? How does that help with feeding? Like, when do you do it? What happens when you're doing
Right.
massage?
So I really like infant massage when it for feeding purposes. The reason being that um, when you massage a baby's face, you are activating all of these muscles in their face that are used for, breathing, eating, swallowing, all of those things. And when babies are born, they really have gone through the ringer sometimes, and they have all these strain patterns within their facial muscles sometimes that they are not able to resolve on their own. And unless we, kind of manually touch them and make them aware of those things, right? And like I said before, that the face being the sensory headquarter of our body, um, massaging the baby's face is going to also give a lot of information to parents as to, oh, does their jaw feel tight? Do they open their mouth wide? Are they crying every time they yawn? All of those things.
Oh, sure. Oh, wow. That's,
Yeah. Yeah.
I mean, think
And
about it.
and
They
does
were,
it
if they have
really hurt
vaginal
them?
delivery, they're like
Mm.
squished their
Mm-hmm.
face. It's like, that, and
Yeah.
their neck.
Yeah.
And even if, especially if it's a
Yes.
vacuum delivery or forceps, think about
Yes. Yes.
C-sections even, people don't realize the amount of manipulation
Mm-hmm.
to a baby's face and skull and
Mhm,
neck
Mm-hmm.
during a
mhm,
cesarean birth. They think, oh, cesarean birth is so much gentler on the baby than a vaginal
Mm-mm.
birth. It's really not.
mhm,
Mm-hmm.
mhm.
So that is, wow, that's a kind of mind-blowing. Like
And
thinking,
and
do
one
they
thing to
cry? Yeah.
remember is that facial skin, the muscles connect from the skin to the bone directly,
Hmm.
Oh, interesting.
or to each other.
Sure.
So when we move the skin of the face, we are actually engaging those muscles beneath the skin, right?
Yeah,
I
that's
do a lot of teaching about facial massage, and
Yeah,
I
yeah,
use those little pictures that you put together about all the
yeah, yeah.
different movements, and it's really neat to see the reaction of the baby to that touch. But parents often would never have touched their baby's face like that because they
Right.
think, I mean, I'm using the global they, like, I don't mean it offensively, but if it's, it's your first baby, you're like, oh, I want to be careful. I don't know if my baby's
Yeah.
going to like that, right? And
Yes.
so sometimes you think you're just barely touching the skin. And I'm like, well, we want to see like a little bit of movement, or sometimes a lot of movements. And some babies, you start moving them around, like,
Yeah.
and they're like, I love this. And then other times they're
Yes.
like, and you're like, and then you respect it. If they make a little bit of noise, you say,
Yes.
okay, I'll come back and do that later. If you're in a better mood, we'll try that again. And I always say like, it's baby spa time, kind
Yes.
of do
It
that.
is baby spa
But
time.
but it really, a lot of parents are reporting that they can do that facial massage immediately before latching the baby on, only if the baby was calm before this moment. And they're like,
Absolutely.
oh my gosh, the latch felt better,
Mhm,
Yeah, like
because,
loosening up all those tight
yeah,
muscles.
as we always
mhm.
say, there's 60 muscles in the face and head that are attached to the tongue. So how the tongue behaves
Right. And
is related to
also
that.
Oh, wow.
making the parents aware that it may not be just the tightness in the muscles, it's maybe the laxity in the muscles that
Mm-hmm.
doesn't allow them to get activated when they actually need to be activated, right?
Mm-hmm.
So
Oh,
we are
wow.
We are doing both. It's improving circulation. It's improving nourishment to the skin organ of the face, and hence improving circulation to the muscles, right? And the muscles are what moves the bone.
Sure. And I
So
would think, as a nurse, I'm going to preemie babies, right? Sometimes have
mm,
trouble getting a strong suck. And so not only loosening tight muscles, but as you're saying, helping to
correct,
strengthen weak muscles might be
correct.
beneficial. Can you describe maybe one type of massage that you might instruct a parent to do before they latch their baby?
Yeah, yeah. One simple thing they can do is massage the jaw. So on either side, they can use the pads of their index finger, middle finger, and just massage the jaw.
Near the
Just
So
ear.
this a little
yeah, near the
gentle
ear, kind of like,
compressive massage near the ear, right where the TMJ would be. I mean, we don't have
yeah,
to
I was just going to say,
anatomically tell them, but right
sure,
anywhere, babies' faces are tiny. So anywhere you touch, you can do a massage along the jawline,
like all the way
right?
down. And
And
I'm
it's
just thinking,
circular massage. Yep.
Mm-hmm.
oh,
And if you
okay.
do it to yourself, even as an
Yeah.
I was going to
adult,
say,
you will
oh, that feels
feel
so good.
that you hold so much tension in your
Yeah.
face.
Yeah.
It's unbelievable the amount of tension we hold in our face, our jaw, even around our eyes and forehead, because either we are looking at the screens all the time or,
Mm.
Sure.
driving and looking far distances. These muscles also fatigue.
Well, we're also looking down at our phone and massaging our phone all the time as we swipe and
And- I
Yeah.
mean, I'm just thinking if you're not driving right now while you're listening to us, if you just took the pads of your finger and placed them on your
Mm-hmm.
cheekbones and just did a
Yeah.
simple compression down,
Mm-hmm.
like how good that feels, right?
Mm-hmm.
So, um,
Yeah.
are there any? We talked about a lot of do's with infant massage, right? But
Right.
are there any don'ts? Like, is there anything that you shouldn't do that's contraindicated for a baby?
So, what I feel is that when it comes to infants where they are compromised in any way in terms of their health, you always want to talk with the healthcare provider of the baby and make sure that they are okay with you massaging, the baby, like babies that have a G tube or,
Mm.
any kind of oral apparatus that they are, So, in that case, like I said again, if there is nothing on the legs, legs are the safest place to start, right? Even if you use two fingers on a preemie baby's leg, it's the
Mm-hmm.
parent's touch that matters. They
Mm.
need to know that my parent is here, I'm loved, I'm protected, and that
Yeah.
amygdala needs to get that message of, "Ooh, I'm loved, I'm loved, I'm loved, I'm loved." Right?
I wanna interject about cats again
Ah,
because you think about cats or tiny thin dogs. You know those tiny adorable little dogs you
pick up
put in.
puppies.
Yeah, well, a puppy, sure, puppies, kittens, cats, and those tiny dogs
Yeah,
who are full adults, but they're teeny tiny. They fit in your purse,
yeah,
right?
yeah.
Those kind of animals, as humans, adult humans, we would easily go and massage their little leg or rub their head in a
Right.
way that many parents don't translate to,
Yeah,
oh, especially for a preemie, but even just a normal, healthy newborn baby who's like
right.
7 or 8 pounds, they're like, oh, I don't know. Would that hurt them? I'm like, dude, how would you touch a puppy right now? You
Yeah,
know?
yeah,
So it's remembering that, like, these are human babies who can be touched and adored and rubbed, listening to their
right.
responses, just like a puppy. You would not do it if they like were like, "Meow," like moved away from you. So
Correct.
it's remembering that our touch can be good. Just because your human baby is small doesn't mean that's not good for them.
Yeah, and especially for you, Melissa, since you do go to the hospitals, right? Or no?
Not anymore.
At the moment, I'm not going to hospitals, but I am visiting new parents as a postpartum visiting nurse in their
Yeah,
homes.
so anytime you see a baby who is premature, those parents are even more scared to handle their babies. So if you
Yes,
can instill some amount of confidence and get the fear out of parenting a very fragile, tiny
Mm-hmm.
baby, it's an easy one thing you can teach them. It doesn't have to be a full massage class that they have to have. It's just like, okay, let's massage the baby's bottom of the baby's feet. Let's start
sure.
there and then move up, you know?
I'm especially preemie babies. If you think about all the ways that they are touched in the NICU
Mm.
that are not
Yeah, the
soothing,
noxious ones,
right?
yes.
Exactly, noxious touch. And so, being able to counteract that with some therapeutic
Mhm.
touch, but and one other thing that you said that I liked is that touch from the parent is important. So even if you had a loving nurse
Yes.
that was doing some therapeutic touch, which nurses can do
Yes,
therapeutic touch, there's
they
been lots of
can.
studies on that.
Yes.
Um, so if there's any nurses listening, I would love for them to learn more about this. But it's still important from coming from the parent, right? Like you're not
Right.
replaced by a postpartum
Right.
doula or by a nurse or by,
Right.
anybody else. The touch and your voice and your touch and your smell and your pheromones and your, is what the baby craves the most. So even if
Yes.
you can only see your baby, especially with these COVID times,
Mm,
my heart goes out to everybody whose baby's in the NICU now, because I know there's a lot of restrictions with
Right.
visiting.
Right.
But even if you can only see your baby for a couple hours a day, know
Yes.
that that time you spend with that baby, it's the quality, as you mentioned, not necessarily the quantity,
Hmm.
and that your touch and you are special to that baby.
And that's what matters to them, that my parent is here for me and my parent's voice is where I am, because that is their home. That's what feels the most familiar to this baby, even though they were born early, because that's the only thing that they know and they heard in the
Mm-hmm.
womb. So,
well, it's also greater
yeah,
for the transition once they are out of the NICU. Then
big
the
one,
parents are
big
like,
one.
I know how to massage you. And the baby, we would hope, is going, oh, I remember your touch. I remember your sound. And
Hmm.
so it's an easier transition to home. And you can
Yeah.
almost make up that time in a way
Hmm.
by really doing even more touch with a baby who's recently out of the NICU so that you can say, oh gosh, I didn't get that time now. I'm really going to do some good massage work with you.
Right. And a lot of the times as lactation consultants, we see parents who for one or the other reason uh, could not breastfeed, and they are at a loss of how to
Mm-hmm.
connect with these babies
Right.
sometimes. And I think that that is a very easy and cost effective way to connect with baby, that you take a class if you want to. Even if you don't want to, you buy a book on infant massage. There are many books out there, and start doing it with your babies. Yes, I teach classes. Yes, I would love to have you in my class. But at the same time, I really truly believe that, we have to take the fear factor out of parenting, and, empower them to
Mm-hmm.
do the things that they could do. And the possibilities are endless.
Mm-hmm.
And the one thing I do want to remind parents is that don't try to use any scented oils or anything.
Right. Good point.
Even if you feel like, oh, I didn't even put deodorant on and I'm stinky, your babies love that stink.
Mm-mm.
That's
Yes,
perfume
they
to
do.
them. They will
I
My
sleep in your
daughter,
armpits.
I was
I
gonna say my daughter
remember,
sleeps in my
yeah,
armpit.
and I
Yeah.
remember reading a book. I love this is one of my favorite little snippets that I learned from this book when I had a new baby. I found this book called What's Going On in There, and it's
Oh.
written by a neuroscientist who specializes
Mhm.
in like the pregnancy to 5 years old brain.
Ooh.
And and I found that like every other paragraph I could understand because she put a lot of like very
Technical
neurosciencey stuff in
jargon.
there.
Yeah.
And but one of the things she said was that kids under the age of about 2 can't decipher between good and bad scents. And I was like, "Oh my God, I love that information." Because I'm very like brush your teeth
Yeah.
kind of person. And I'm like, "Oh my God, my poor baby." And like, no, they don't care. They have no
They don't
sense. They have
care.
no sense of good or bad. And so it's
They
just,
want to
yes,
breastfeed
even
while you're
better.
pooping. That
Yeah.
They do. They
There's
do.
there's a how-to video in there somewhere.
Yeah, right.
Oh
I'm
my gosh,
sure.
that's
I'm
awesome.
sure.
Next time, well, Melissa, yours is getting kind of big now.
That's true.
But all right, awesome. So for people who want to learn more,
Mhm.
how do they like what are some of the resources that you would just say maybe on the internet or certain books that you'd recommend and then your classes like what are your classes? What does that encompass?
Mm-hmm. Yeah, so if anybody wants to take my classes, they are all virtual. And I really feel that the virtual classes are helping so many parents in terms of how they are interacting with their babies, with each other. We can form a community of parents, right, online. And I had a few parents that joined me from the UK. I had a few parents that joined me from the East Coast. And I'm trying to come up with a group for parents who are in Israel.
Mm.
So
Oh,
I'm
wow.
hoping that we, and I'm sure there are other folks teaching virtually as well. And I say that find those people who are teaching in your area, and virtual. You can go anywhere basically. It can come to anybody's living room, and that's what I like about going virtual. So they can find my classes on my website at kindredmothercare.com. And the certifying organization for me was International Association of Infant Massage, and their website is IAIM.net. And there are other certifying organizations like WINC, or Little Kids Foundation, and they all teach pretty much similar concepts on infant massage if you want to be an infant massage educator. And if you're a parent,
Wonderful.
you can find an infant massage educator in your area at the IAIM website and connect with them. Some people can do one-on-one classes. If you are not the person who likes group sessions, then you can do one-on-one. And I think that whether you take the classes or not, start massaging your babies would be my
Yes.
message for every single one of us. And my most memorable time with infant massage was, I had a client whose baby was older, and had just started walking, and she started coming to my infant massage class. And this baby had Down syndrome, and but she was able to understand, and she was very active. And by the second massage class, she would bring the bottle of massage oil to the mom and do this, that I
Oh,
want to
she'd
massage,
rub her
I want
hands
you to
together.
massage.
Yeah.
Yes. And that is something that I cherish to this day, that that makes it worth it for me. And it's never too late, like I said.
Hmm.
Even for your 3-year-old, if you start doing foot rubs every night, they will get used to it. um, I just feel like just do it.
Yeah. Or 5 or
That's
6 or
wonderful.
7 or 8 or 9 or 10. I
Yes,
think once they
yes,
get
yes,
to
yes,
12, it depends on their personality. But
yes, yes. Hmm.
more
Thank you
like
so
that.
much,
Oh my gosh,
Sejal.
yes. This
This
is
has been
great.
such a wonderful conversation, and I've learned so much. That's why I love
Thank
doing these
you.
podcasts.
I
I
know.
feel like you can always learn, no matter even if you're in this field of work. And again, if any of
Yes.
you want to learn more about classes Sejal offers, again, even though she's in Oregon, she's virtual now because of the pandemic, so you can take them anywhere around the world. Visit her website at Kindred Mother Care. That's KINDRED mothercare.com. And we hope that you will just start with a leg. I think it's
Yes.
going to be the motto of the show. Just start with a leg tonight.
And you can say that at Thanksgiving too. All right, awesome. And we hope you'll visit babiesincommon.com/show to view all our previous episodes and see what we have coming up as well. And our show's available as video on our website, or a podcast on our website, or on Spotify or Apple Podcasts. And we hope you would also consider writing a review. So check out babiesincommon.com for everything else we offer. And remember, as always, Babies in Common is a community for you. After all, we all have babies in common.
Babies in common.
Yes.
All right.
Thank you
All
very
right,
much,
thank
Sejal.
you.
Thank you.